Okay. Okay, now can you guys see me? And also, can you see the presentation? Okay, I need to have my little box here, else I can't see when you guys chat. Let me open it right here. Perfect. Awesome. Thank you so much. Let me turn it off for now. If you guys have any questions along the way, go ahead, and I'm going to be checking the chat box. Do not don't write where the Q&A is, because sometimes we don't see the messages there. Okay, sometimes we can't see the notification when it shows up that there's a Q&A, but I do see the chat box that it kind of shows me that somebody's asking questions, so I can do that. Okay, so again, welcome. How are you guys today? My name is Esperanza, and I'm so happy to be here with you today. Um, just one moment. Hold on one little bit. I'm so sorry. Little technical difficulties. Okay, we're back. Sorry for that. Again, let me introduce myself one more time. My name is Esperanza, and today I'm going to be joining you with the webinar for treatments for glutes. We're going to be talking about specifically the lining of the area, okay? And this is a treatment that a lot of people are asking about. It's interesting because obviously we know that everybody's interested about peels in areas such as the underarms, and you know what we call the intimate areas as well. But there's also a lot of people that are asking, or customers that are asking for the glutes as well. And we are coming into summer now, and this is kind of like the time to start working on the area if you want to go out and go and enjoy the summer in your bathing suits. So if you are new with us here, um, with Derma, I'm going to talk to you a little bit about our company. And first of all, it's an exclusive skincare brand that's been in the market for over 27 years now. We are professional products. So you're going to have the advantage of having your back bar. Okay, you're going to have your back bar, but you're also going to have the products that are going to help you with your clients, and give you the support at home that you need for your clients. We have the ingredients with highest of qualities. They're botanical, they're marine and biological origin. So basically, it's a very natural line. We have products for all skin types, but also all skin conditions. And what I love about our products is that you don't just have, for all skin types and conditions, but it's basically a very compact line that is very versatile. You're able to, along the way, mix and match some of the products where you can create your own protocols. But having that said, that doesn't mean that we don't guide you along the way with protocols. We already have set protocols that you guys can use, especially when you're starting to use the line and kind of get to know the line. So we're to have those done for you. So if you have a representative, and if you're new to us or you're already working with us, you know that you have access to those protocol catalogs where you basically have, for all types of different types of skin treatments that you can offer to your clients. Again, line's paraben free. It's not animal tested, which to us it's very important because we are very aware of the environment as well. And we are very passionate about education. So you're going to see how we're always trying to, we're always going to be online somehow. We're always going to be either through seminars, webinars, or through Instagram as well. So education is very important. As a skincare line, as a professional skincare line, it's not just about, talking about Derma's line, but it's also educating about skincare, and helping our estheticians to understand a little bit more about the different technologies and all the different treatments that are out there nowadays. So yes, we are pioneers in education. we also have the Derma Institute, which allows us to have students that want to have the license in the state of Florida. And so they go through our the months that they need to do their hours, and we give them all the paperwork so that they can go ahead and get their license with the state of Florida. For now, we also have the program online, so we're able to teach, or we're able to give classes not just to those who are here in Miami, but all over the state of Florida. And we've also had some others that want to get the license in the state of Florida. They want to get their hours, they get the license, but they also redo the hours that they need in the state that they're at. So we've had students from Texas, New York, North Carolina, because they like the method of Derma Swiss. So that's very interesting. That means that we're able to now open up our doors even further, not just here in Doral, Florida. So here are the advantages of the line that I was mentioning to you before. First of all, it's a very effective line. You're going to see on the very first time that you use a product on your client, the change on their skin. We do know that for it to be a permanent change or to create more change on the skin, our clients need to come back and they're going to have a routine at home. But the line is very effective and it's very gentle, which is something that is also very important for us because, especially when it comes to chemical peels. Our peels, it's a line where we have alpha hydroxy acids and beta hydroxy acids. So in the family we have the lactic, we have mandelic, we have glycolic, and we have also our salicylic acid, which is our beta hydroxy acid. We also have the line can be used in day spas, it can be used in medical spas as well. And the strong corporate support. What does that mean? That means that, as some of you already know, you will have a sales representative that is always going to guide you, that will always have the answers that you need when you have any questions and doubts. And if you don't have somebody right now that is guiding you through our products and protocols, you can call us and we can also have somebody contact you back for them to be your representative. We're also very dedicated with education, like I mentioned before, not just for the students who are seeking to have the license, but also for professionals as well. So again, you're always going to find us through our social media. Okay, this is the ways that you can find us through our social media. We have the Derma Swiss Pro, which basically it's the account on Instagram where you're going to find all information for our estheticians, for our professionals. Then we're going to have Derma Swiss Institute, which is all the information about our school. There you can see, the different classes that we have. You can see pictures of them practicing as well during their lab hours. And then we have the at Derma Swiss, which is the retail side of the of our company. So that one's great for you estheticians who want to share the products, the retail products to your customers. You can share that account. So we're going to get into it now. We're going to get into the, let me just check if we have any questions. Okay, perfect. So what causes, the causes of hyperpigmentation on the glutes, okay? We know that one of those causes are prolonged frictions or rubbing. We know that this is going to cause hyperpigmentation when it comes to prolonged frictions and rubbing in any area. In any given time, it's going to start causing a sort of inflammation on the skin. Once that starts to happen and there's redness with, on every day, it could be shoes, it could be the belt around the waist. And in the case of the buttocks, it could be the underwear. That can lead to a lot of that friction. So progressively, it's going to start irritating the skin, and that's going to cause a sort of inflammation. You might not notice it as such. It's not going to be probably swollen or anything like that. But sometimes there's itching, and every day that starts to accumulate, and on the long run, it's going to show as hyperpigmentation. That's how we know that it's a type of post-inflammatory hyperpigmentation. So whenever we wear tight clothing, maybe we've gained weight, or whatever the reason is, it's going to start to happen where those areas are going to start to get darkened. Another of those causes are obesity, being overweight, friction in the areas. And again, it's not just going to happen on the glutes, it will happen in women around the bra line as well. It's going to happen maybe under the arms as well. And it might happen around the neck too. So these are areas that you can also treat very well with this type of treatment. It's not just for the glutes. Of course, we are talking about it because, like I said before, there's clients that are interested in that type of treatment, but that doesn't mean that you can't do it on those other areas as well. So, yeah, obesity and overweight, people that are overweight are going to generate as well more swelling in the area. And, with moisture and maybe sweating, then obviously that's going to, on the long run, start presenting as hyperpigmentation. Sweaty clothing. It's very important to us to guide our clients when they go to the gym, that not just because some of them might get breakouts as well, but when it comes to hyperpigmentation, obviously with the sweat on the skin, if they don't bathe right away or they don't change their clothes and dry out, the acid from the sweat is going to start hurting the skin. And I know of some people that it's very irritating for their skin, so that it's going to also present itself as hyperpigmentation in the future if they don't treat it, or if they don't change the ways of them changing in their new clothes and dry clothes after the gym. And then another of the causes, of course, is acne. Yes, there's also acne on the back area, on the buttocks as well. And in that case, while the acne is still active, then you're going to want to do the treatment for our acne treatment, where you're going to be using the acne line, and you're going to be using the same protocol that you would when you have acne on a client, their chest, their back, and even the buttocks areas as well. But when it comes to lining the area, you just want to wait until there's less inflammation, especially if we're talking about pustules. You want to wait for that. So you want to take care first of the main problem, would be the acne, the pustules. And then once that kind of, gets better, then you want to start treating post-inflammatory hyperpigmentation due to acne. So there we have the typical, glutes with acne as well. In this case, you can see that this person still kind of has some breakouts in the area. You can tell that some of the lesions are still kind of new. Okay, but then you can also kind of appreciate that there are some other lesions that are kind of starting to not fade away, but they're obviously not inflamed, but they're staying kind of red. This is when you want to start attacking the acne. Okay, you don't want it when it's active. You don't want those pustules there. But once it starts to calm down a little bit and the acne is not so angry in the area, then that's when you want to start treating the glutes for the lining treatment. Again, once we talked about being overweight, how that's going to, it's going to be part of the cost, why some of our clients might have hyperpigmentation in certain areas and in the glutes, but also spending a lot of time sitting. Uh, some of us who spend a lot of time in the office or sitting or working on the computer, that's going to create discoloration on the bottom side of the buttocks, and probably down to the legs as well. So that's that big tendency in that area because of that. Pregnancy, again, pregnancy, we see hyperpigmentation in different areas of the body, under the arms, on the buttocks, on the line where the belly button goes down on the belly. We also see, I mean, that's all due to hormones, of course. And in the case of melasma, it's due to hormones, but it can happen as well. We gain weight as women when we are in pregnancy. So, we might not be choosing the right clothing, and we're going to have more of the friction as well. So that's probably going to have that, you're going to have that outcome of hyperpigmentation in the glutes. And And another cause is diabetes. Okay, diabetes is, when you see the darkening around the neck in some people, also under the arms, and that's known as acanthosis nigricans. And it's basically when you see a client that might have that thickening, not just darkening, but thickening of the skin, and it's dark, a dark ring around the neck area from the back all the way to the front. And they might also have it under their arms and on the elbows as well. Then there's probably an underlying problem with diabetes too. So in that case, you can treat it. Obviously, I mean, while the diabetes not being controlled by doctor, that's probably a side effect that's always going to be there. But once they start treatment, we can always help by doing this type of protocols on them, and it can start to kind of lighten down a little bit more. Okay, here is an image of the acanthosis nigricans, and that's what I was talking about. Do you see how it's not just your typical hyperpigmentation where it might be in a brownish color? In this case, sometimes it gets really, really dark, but it also gets wrinkly. The skin in the area tends to be very dry as well, and it's very thick. So that's an indication in some cases that there's an underlying problem of diabetes. Let me check if there's any questions. Okay, a moment. Okay, perfect. Let me know if you guys have any questions through the chat box, and I'll be happy to answer. Again, another image, and you see again the neck area. So it's not like your typical post-inflammatory due to, maybe friction in the belt area, the waist, or maybe friction because, I don't know, the neckline, the way that they're using their clothing or uniforms that they might use. There's a little bit different. There's a thickening of the skin. There's dryness around the area, and it's an underlying condition of diabetes and also on obesity. So sometimes they kind of go with each other. So it's not that we should be careful about applying the products, but it's better for them to first have it under control. Once they have it under control, then we can start treating with peels. Okay, because remember, diabetes it's a it can also affect the autoimmune system. So this is an image where we have your typical hyperpigmentation on the glutes area, and this is the areas where we see it and people want to treat a lot. Okay, from the center to the outside and the bottom, that's where you start seeing the hyperpigmentation. Again, this can also be up all the way to the waistline. Okay, so you can treat all that area the same way. But that's your typical image of somebody with hyperpigmentation, because that's where you have, the clothing is mostly having friction, and also the friction with the same skin as well. Those areas start to get dark, and some clients want to, kind of fix that a little bit. Okay. And then we have folliculitis. So folliculitis is basically when the hair becomes embedded, and this can happen on the buttocks area. It can happen, we know that on the face as well, depending on, if people are shaving the wrong way, or just because they have the tendency of inflammation of the follicles, and they're gonna develop folliculitis. So in the case of the buttocks, it can happen. There's, especially in men, it can happen where they have hairs on their butt area, and maybe the way that their underwear is not sitting correctly, and it's creating that friction as well. Maybe the seat is really hot. That can also inflame the area and inflame the follicles, and it can be a cause for folliculitis. So what happens after the folliculitis has healed, those follicles that were red and there was an inflammation, then it starts to create hyperpigmentation around the area. So it almost looks like acne. It's almost going to look like the same kind of lesion as acne, but in this case, it's just inflammation of the follicle because of those embedded hairs. What can you do to prevent that? Okay, you can tell your client that exfoliating in the area would be great, because that way they don't have so much of an incidence of those follicles blocking. That's one thing. And then the other way is just by doing the same treatment that we're going to talk about today, where you can treat once a week or every 2 weeks the area, so they have less instances of folliculitis in the area. But that's another cause. Okay. So this is the type of folliculitis when it's on the glutes. So like I mentioned before, you really have to distinguish where it's, if it's an acne or if it's a follicle. Usually we can tell because you see, if you look really closely, you're gonna see that the follicle, it's gonna be inflamed. There's usually no pus or anything like that. And you can see that maybe the, the hair, it's trying to come out. The problem with folliculitis in some areas, if people are shaving, that's another problem. If they're shaving those areas and it's, has a tendency, then they need to stop. It could be also bad wax. Okay, it could be a bad a wax treatment gone wrong. Then that can also cause folliculitis. So when they come to us as an esthetician, the only thing we can do is help by exfoliating with our chemical peels. So this is the way that I was telling you how to avoid the folliculitis on the glutes, and it's by applying scrubs to remove the dead skin cells. That's going to help with unblocking the follicles. In our case, we have our derma scrub, and the derma scrub is not just a physical scrub; it's also an enzyme. Okay, so it does contain the papaya enzyme, and you are able to leave it on the area if you want. If it's too sensitive, you don't have to move it around or anything like that, because it is an enzyme. It's going to help remove those proteins from the dead skin cells, and it's going to help with exfoliating the area. So whenever you have anyone with even sensitive skin on the face, this is the way to go. You're going to do the derma scrub. You're going to apply it with a brush. You're going to leave it on the skin. If they're very sensitive, you don't have to move it around. And in the buttocks area, you would do the same thing. You can also, if you know your client's very responsible, they're not going to be over exfoliating, you will be able to sell to them the retail size, and they can also do that at home once a week. Okay, I think I have somebody here with a question. Let me see. Eliette, you can add, if you have a question, you can add it to the chat box so I can see. Let me see. Okay. So if anybody has a question, if anybody came in later, you can go to the chat box and you can ask. Okay. Alrighty. Okay, so she's good. If you guys have any questions, let me know. I'm happy to answer. Perfect. Okay. So again, our derma scrub is an enzymatic scrub. When you have a more of the buttocks area, it's obviously it's going to be more resistant than our skin on our face. So you can also exfoliate that area with the enzyme. But like I said before, a way for your client to kind of avoid those blockages of folliculitis is by them doing it themselves at home as well. So, just train them very responsibly to, to scrub the area once a week, and that's going to definitely help with unclogging the pores and the follicles. So avoid the use of waxes. If there's a tendency for folliculitis, they need to either find themselves a really good wax technician, okay, and also stop using razors. Anything that's razors is gonna probably create that inflammation on the follicles as well. And like it says here, the laser may be the best technique to remove hair. In cases where it's so extreme, where the folliculitis is always present, then the best thing that we can tell our client is for laser treatment or electrolysis, which is the most permanent type of hair removal there is. Apply moisturizers to the area as well. Avoid greasy type of products on the area so that you can avoid, again, clogging the follicle. And at least once or twice a week, you can exfoliate the area, and that's going to help a lot. And it's not just this is not a recommendation just for the glutes, but this is a recommendation also for areas where you have keratosis pilaris, for example, on the, there's keratosis pilaris on the buttocks area, Some of our clients may have it on their arms, okay, and some even on the face. So a little bit of exfoliating, that's going to help with the keratosis pilaris, which is kind of like what we call the chicken skin. Well, that's going to help as well with removing, in that case, is dead skin cells that have been accumulating there. And it's going to help soften the skin a bit more, okay? Give it more of a smooth texture. They can use it on the buttocks, they can use it on the arms for keratosis pilaris, and on the face. And I would say responsibility, because sometimes when we give our clients, exfoliating products, they kind of go overboard. They kind of feel like the more it's better, but it's not. So we need to really guide them and show them how to use it and how many times a week they should use it, so that they don't go and commit, they can create a problem by over exfoliating as well. Okay. So here's the protocol for the folliculitis on the glutes. So what would you do? You're going to cleanse the skin with the derma cleanser. So our derma cleanser, it's our cleanser for all skin types. It has aloe vera, it has chamomile. So it's the texture is like a gel texture, but it's not very soapy. So it's not very detersive. It's not a detergent. Okay. So it's great for all your skins, even your sensitives. Although we do have for sensitive skin, sorry, our gentle cleanser, but the gentle cleanser is more of a cream. So you don't want to use that when you have folliculitis, because we're talking about those follicles that have been clogged somehow. So you want to use the derma cleanser. You're going to cleanse the area, and then you're going to apply the glycolic 30%. So we have two types of peels. We have glycolic 30%, and we have it at 40%. In this case, you're going to use the 30%, and you're going to apply it with the brush all over the area in the case of the buttocks where you have the folliculitis, and you're going to leave it there for 3 minutes. Okay, once the time's up for the 3 minutes, you want to neutralize. You're going to go ahead and you're going to neutralize, and then you're going to also remove the neutralizer with plenty of water, and dry the area, and then you're just going to apply the epifactor. Now our epifactor, it's our tissue repair. Okay, it helps with restoring epithelial tissue. It's going to help with it has the healing benefits, and this is where you're going to have your client, this is where you're going to apply on the skin of the client after you do the peel. But what you can sell for your client to use at home, it's our glycocell. So the glycocell is it's also glycolic acid, but in this case, it's 12% concentration, and it's almost like a micro pill. Okay, so it's a lower concentration, and you can use at home um, in the areas where you need to exfoliate. So instead of maybe using the scrub, you can also give them or sell them the retail size of the glycocell. And again, you know, telling them how to use it. They can probably do it twice a week, where just in the area, it's going to help with removing dead skin cells and unblocking the follicle. So this is a great product for them to use at home. That it's going to help with sort of like a micro exfoliation with a peel of a 12%. Okay, so that's what you would give them to take home. And we're talking about the glutes area, okay? So we're not talking about the face or anything like that. This is the glutes area. And if the problem persists, then this is what they should be doing at home. They should be using the glycocell. And then I would say that maybe for your visits with you, just to get it better and to see how it's going to develop, they can come every 15 days, every 20 days for a peel treatment directly on the skin. Oh, so here's the glycosol that I was explaining to you. So again, it's a 12% concentration. It's exfoliating. It's going to help to improve, obviously, fine lines and wrinkles, because again, the glycosol is not just for the buttocks area. If you guys are new to DermaSwiss, we combine our glycosol with the derma scrub. So the glycosol and the derma scrub are kind of like great partners when it comes to your treatment room. About a quarter size of derma scrub and 2 pumps of glycosol, and you use it mix them together and you apply them on the skin, and it's going to help with the sequestration. So this is what we use before our extractions. Leave it on the skin, you put on the steamer, and it's going to be great for helping you with extractions. So this is not, again, not just for the buttocks area, but in general, this is what we use for our exfoliating before extractions. It does contain urea and chamomile, which is very soothing. Green tea as an antioxidant. So again, when you use it on the skin, you're not going to feel any sort of, tingling. A little bit of tingling, but there's no burning sensation or anything like that. When you do have a client with very sensitive skin, rosacea, then you might want to skip the glycosol and just use the derma scrub. So for hyperpigmentation on the glutes, this is the one that we're going to be doing. And we're going to cleanse the skin with the derma cleanser, and then you're going to apply the scrub. Okay, we're going to apply the scrub, and we're going to activate it with circular movements. We're going to start activating the area with circular movements, especially where you see those more of dark areas. You want to work on that. Then you're going to remove it, and I'm going to show you this. We're going to have a little demo here, so you're going to see how we do it. Once you remove with water the derma scrub, you are going to apply the lactic acid. So let me check right here. One moment. Let me just have it to see if we have it here. No. Okay, we'll go back. So lactic acid. Our lactic acid is a 50% concentration, 2.8 pH. It's amazing in general, for hyperpigmentation. But when we know the lactic acid has very hydrating properties, and it's not as strong as our glycolic. So it's going to help with the benefits of hyperpigmentation without being too irritating for those that have more sensitive skin. The thing is, with the lactic acid, since this is for the buttocks area, you can leave it up to 10 minutes if the skin allows. So obviously we're going to be checking on the client. Want to make sure you don't want to leave the room. You want to stay there when they have the lactic acid on the skin, just to make sure everything's okay. But you can leave it up to 8 to 10 minutes on the buttocks area. When you're working on the glutes, if you work on the face, it's not going to be for 8 minutes. It's going to be for only 2 minutes. But lactic acid on the glutes, 8 to 10 minutes is going to be perfect. Once the time's done, then you neutralize it, and then you remove with plenty of water. And then after that, we're going to apply the vitamin C mask. Now, this vitamin C mask comes in like little patches. So you can use about 2 or 3 of those patches. We're going to mix it with a little bit of our toner, our dermatonic, and you can apply it on the skin. Now, there are 2 ways that you can do it. You can apply the patches directly on the glutes, and you kind of spray the toner on top of it and start diluting it. It's gonna become diluted, and kind of working it on the skin of the glutes. Or you can dilute it in a little bowl like this one. Okay, you put your little patches in here, a little bit of the dermatoner, and then you mix it, and then you apply it with a brush, but you still want to massage it into the skin. Why? Because that's going to activate all the active ingredients on the mask, which are going to help with lining. The vitamin C mask, it's great, obviously, for hyperpigmentation. But if you're going to use it on your clients on the face, then it's great for those that have hyperpigmentation, or their skin they need the glow on the skin, or asphyxiated by the elements, by pollution, smokers skin, for example, that it's kind of dull. Then you want to use that one. It's amazing for just giving the luminosity to the skin. So you're going to massage it for about 5 minutes, and then you're going to leave it on for 15 minutes. Once it dries up, then you're going to remove it with plenty of water. You're going to apply again the Epifactor, and then again, for your client to use at home, you can send them home with the Epifactor, which is going to they're going to be using for 3 days. Because since you're going to be doing a direct peel, and you're going to be doing more of a it's a 50% peel, so it's a little bit more stronger, then you want to have them take home the Epifactor that is going to help with the healing of the skin, epithelial tissue, regrowth of the cells. It's also going to heal, and it's also going to prevent any sort of post-inflammatory hyperpigmentation due to the peel as well. That's the scrub. So the derma scrub, it's an enzymatic scrub. We can mix it again with the glycocell, but you can also mix it with our other peels. So the derma scrub, depending on the type of skin that you're working on, when it comes to the facials, you can use either the glycocell, or if you have somebody with rosacea, you could do about, you can combine it with a little bit of the of the glycosol. If you have somebody with dry skin, there's dehydration, or the skin it's kind of thinner, then you will use the lactic acid. So more of a mature type skin where it's dry and it's thinner, then you use 3 drops in combination with the derma scrub. You mix them together and you apply it on the skin. This is also very helpful if you have somebody, or if you're someone that you're not used to using our peels yet. So by combining it with the derma scrub, it kind of takes away a little bit of that edge of the peel. It makes it a little bit more gentle, so you can do that. All of these methods right here you could use while you have the steamer on. Okay, so this is a way for the sequestration. Okay, but instead of using the glycosol, you can use the lactic acid, or you could use salicylic if you have somebody with very oily skin or acne prone skin. Again, the derma scrub in combination with 3 drops of lactic acid. Okay, you mix it, you apply it on the skin, and you let it sit there for about 10 minutes. And then if you're going to do extractions, you can also apply you can have the steamer on while those 8 to 10 minutes pass, and you can after that do your extractions perfectly well. So those are other ways that you can combine our peels with the derma scrub. Oh, that's the one I was looking for, the lactic acid. So those are the properties. Again, it's water soluble. Why? Because it's an alpha hydroxy acid. We already know that it's extracted from fermented milk. Um, it's great for rejuvenating. It's amazing on more mature type skin, drier type skin. It is very hydrating. It does also stimulate the synthesis of collagen, help with fine lines and wrinkles. You do have to remember that with lactic acid, it's a little bit more photosensitive in comparison to glycolic. So always, recommend to your clients for them to always be using their sunscreen after a lactic acid peel, and not just on the day of the treatment, but 3-4 days after, to be very conscientious about using their SPF. So it's very, very hydrating. And this is the one that we use for our protocols for the underarms, neck, and the groin area as well. So basically, the treatment that we're going to be doing today is the same one that you can offer to your clients for the underarms area, the groin area, and also for neck area, um, even the elbows. You know how the elbows and then get kind of dark? You can use that same protocol as well. So you can offer the same one, not just for but also for those areas as well. And then the neutralizer, we're always going to neutralize our peels all the time. We're always going to neutralize. So we're always going to leave them on for the amount of time suggested by the protocol. And then you're always going to want to neutralize. It's basically bicarbonate solution, which is alkaline, which is going to bring back the pH of the skin, and it's going to help us neutralize the peel. And this is the vitamin C mask. As you can see, it does contain squalane, which is very hydrating, ascorbic acid, and it's also going to have some marine extracts by the use of seaweed. So when it comes to allergies, be careful because it does have a mix of seaweed in part of the active ingredients, polysaccharides and squalane, which is going to help us with hydration of the skin. They're soluble little patches, and it comes like that. You can tell that it comes with 5 patches in an envelope. So depending on the skin, you can use all of them, or you can use 2 or 3 or 4 patches, whatever you want. In the case of the glutes, we're going to use 2 or 3 patches, and we're going to dilute it with the dermatonic. We're going to apply it on the skin, and you're going to massage. If you do this on the face, you would do the same thing. You want to dilute it with dermatonic, you apply it with a brush, and then that's when you're going to do your facial massage. with the mask. So instead of using creams, instead of using oils on the skin, you want to use the vitamin C mask, and that's going to be your method of, that's what you're going to be using for massaging the skin. And you leave it on for 10-15 minutes, and then you remove it. So it can be removed as gommage or with wet sponges. Any questions? Anybody? Okay, let me go to what I'm gonna do right now. Oh, okay, so this is important because, okay, there's also a treatment for stretch marks. So we know stretch marks, okay, they're hard to treat. They're very pesky. They're, once you get them, we freak out because we know they're gonna kind of stay there forever. Nowadays, there are ways of different treatments that we can do, but you have to catch them as soon as they come out. So if you have a client that comes in with stretch marks that are looking white already or kind of silvery tone, then you're probably not going to be able to do a lot when we talk about peels. But if your client comes in and the stretch marks are no more than 6 months since they developed, then you can still treat them with the peels. So this is a protocol. If you guys want to see right here, this is the protocol for stretch marks. So in the case of the stretch marks, we are going to cleanse the area first, but then you're gonna get a Q-tip, okay? You can get a Q-tip, or you can get like the ones that we use for the glycolic application, the bigger ones, and you're gonna saturate it with the 40% glycolic acid, okay? So remember, we have two, okay? We have the 30%. Where is it? Where'd it go? Glycolic. So we have the 30%, but we have also the 40% concentration. So obviously the 40% concentration is going to be a little stronger. And this is the one that we're going to use for stretch marks. So you want to saturate a Q-tip, and then you want to kind of line or cover the lines of the stretch mark. So it could be kind of tedious, but it shouldn't take that long, because with this protocol, you're just going to, with the Q-tip, you're gonna apply it on the red areas of the stretch mark, and you're just gonna leave it for 7 minutes, always watching for your client. If they feel a little burning sensation, if they can't take it, then you want to neutralize it. But the protocol doesn't want you to neutralize, okay? This is only when the person's fine, they're not feeling any sort of burning sensation or any sort of, burning or itching or anything like that, then you leave it on. You don't neutralize it. You just leave it on the area. After the 7 minutes, they're good to go. You're only going to apply the ceramide, which is our moisturizer. So the ceramide, we have four moisturizers. Ceramide is one of the more emollient ones. It's a cream. Okay. So what you want to do is you want to apply the ceramide on top, because it has panthenol, which is going to be very hydrating. It has it also has hydrolyzed collagen, so it's going to help soothe and help with the repairing as well. And you're creating that occlusiveness because it's a thicker kind of hydration. So once you have the glycolic there, you want to cover it and hydrate it very well so that the skin doesn't become damaged. And then you repeat it once a week for 6 to 12 sessions. So the client needs to be coming back for once a week up to 12 weeks, so that they can start noticing a difference on the stretch marks. How much would you charge for this? It's going to depend on the area where you are. For us here in Miami, we can charge from 50 to 60 up to $70 a session. So I don't know how it is where you guys are, but that's kind of like a recommended. That's the recommended amount. And also for the lining, for the glutes, for the lining of the glutes, again, you can remember you're using products, you're using the peels as well. It shouldn't take a long time, but it's still the usage of products that you're going to take into consideration. And sometimes I've had some of the estheticians ask me if they can do microdermabrasion, for example, okay, when it comes to hyperpigmentation. So my answer to that is, if you are going to do microdermabrasion, don't use the derma scrub, okay? So cleanse the skin and then do only one pass, but be super careful, because remember, with the diamond tip, sometimes we can leave marks. So you don't have to overdo it. Just one light pass, kind of to remove the upper layers. And then you apply the peel, the lactic acid. When we're talking about the protocol for hyperpigmentation, you would apply the lactic acid. So you have to be careful about that because obviously we're doing a peel after the microdermabrasion. So we're kind of opening up the area a little bit more, and it could be irritating if we do it too hard. So that I'm telling you this because I've had people ask me, and yes, you can. You just have to be careful. So that's our protocol for stretch marks. Do you guys have any questions up to now? Anybody? Let's see. Okay, no questions. Okay, so if you guys have your representatives, you can ask them to send you all these protocols. If you don't have a representative, you can call our number 305-663-2882 if you're new to DermaSwiss, and we can always have somebody call you back for more information. But you do have to be working with the products so that you can get the protocol book. We have a booklet filled with protocols. And then for today, we do have a 10% discount on the kit. So this is the kit that you would use. It says underarm kit, but this is the same kit that you're going to use for the underarm, for the glutes, for the neck area, if you have, for the groin area. So it's basically the same protocol. When it comes to the derma cleanser and the derma scrub, the derma tonic, you're going to get the professional size, and it's a 17-ounce bottle. You're going to get the Epi Factor, also professional, and the derma scrub, also the professional size. Obviously, this is for your back bar. You're also going to be getting the lactic acid. You're going to be getting the lactic acid is going to give you for about 30 treatments, okay? Because usually for the buttocks, it's going to give, you're going to have one dropper. Again, depending on your client, you might need less or more. But with one dropper on one side and then one dropper on the other side, that's about the amount. But in general, you get about 30 uses of the peels, okay? Because you usually use one dropper for the face. Obviously, if you keep adding areas, then you add more to the prices. And then you're going to get the lactic acid, you're going to get the neutralizer, and you're going to get 10 packs of vitamin C. So you're going to get 10 envelopes of the vitamin C mask, in which you get 5 patches. And you don't have to use all the five patches. You can use 2, you can use 3. So you're going to be getting more out of that as well. So the normal value is $3,200. And for today, those of you who are here in the webinar, you're going to have a 10% discount. It's going to be at $270. We're talking about with the peel. If you use up the peel, you're talking about 30 treatments. 30 treatments, okay? If you do underarms, with one of those droppers, you have the 2 underarms. You can work the 2 underarms with the 2 droppers. So you're going to do, let's say, an average of 30 treatments. You have a great comeback only with the peels. I'm not even mentioning the Epi Factor, which is like one pump. The derma scrub, it's about the quarter size that you're going to use, like a teaspoon size of the derma scrub. And the derma tonic and the derma cleanser, you have about 250 pumps. So that's a lot of uses out of the products, okay? This is the protocol for the underarm winding. This one, the only difference with the other one is that before they used to do the lactic acid first, and then they would do the scrub. We're not doing it like that anymore. So I'm not even gonna get you confused. We're gonna go back to the regular, the new protocol, which is first the derma scrub and then the lactic acid. So this is a description of our glycolic. Again, it's a smaller molecule. It's also an alpha hydroxy acid. And this is what it's widely used in cosmetic. Okay, glycolic is like the popular one when it comes to anti-aging. It's gonna help with, wrinkle promotion of the collagen stimulation, but it's also gonna help with thickening the dermis. This is why it's so popular, and it's gonna help also with hyperpigmentation, melasma, and things like that. The ceramide is what we're gonna use if you want to add for the stretch marks, okay? For the stretch marks, you would want to add the 40% glycolic into your purchase and the ceramide. And again, the ceramide, since it's going to be very hydrating, it's going to be, it's going to prevent the transepidermal water loss. And this is why we're partnering it up with the 40% glycolic, because it's a stronger peel. So you want to avoid any transepidermal water loss after the treatment, but it's also going to help because of the aloe vera, the hyaluronic acid, and everything that's going to keep the moisture into the skin is going to help a lot, especially when it comes to stretch marks, that we know that sometimes is lack of moisture as well. So there's no elasticity to the skin. Okay. Um, the derma C, I'm showing you the derma C because your client, if they can also use this on the glutes area. Our derma C, it's our serum, our vitamin C serum. It also has ferulic acid. The two of them together are going to combat with antioxidants, are going to combat hyperpigmentation. It is a tyrannoise inhibitor, and it also contains melanostatin, which is a nanopeptide that it's going to basically diminish and the hormone that that aids with the creation of melanin. So in a way, it's blocking just not just by melanin inhibition, but also by the tyrosinase inhibition. It does also contain hyaluronic acid and rice extract. So it's very powerful when it comes to hyperpigmentation and leaving your skin glowing, and fighting free radicals as well, because it's a potent antioxidant as well. Okay, so you can offer that to your client. And also the epifactor, again, it's epidermal growth factor. It's going to regenerate the skin. It's going to help with the cell turnover. It's going to help with healing. This is the one you're going to be using after every treatment, not just peels. You're going to use it after peels. You're going to use it after microdermabrasion. You're going to use it after microneedling, especially. Why? Because it's going to have the effects on the skin with healing. You're going to have the epidermal growth, and it's also helping any type of wound healing as well. I even use it on paper cuts. I use it if I'm cooking and I get some droplets of oil and I kind of burn myself. I go and I run and get my epifactor, because it doesn't leave any lesions behind, or it helps with preventing hyperpigmentation. So this is great. This is your 911. This is what's gonna help you if there's even an allergic reaction to any of the products that you're using. You want to apply epifactor, and it's gonna help with that as well. So what does it have as key ingredients? Aloe vera, the bioplasma FA, which is basically the formula, which is a plankton extract, and this is a marine fossil, and it contains a lot of the proteins that are going to help with healing of the skin as well. It also has hydrolyzed hyaluronic acid and urea, which is going to maintain the skin hydration. Okay, so what I'm going to do right now is I'm going to go get my model. I'm going to set up the area. I am going to turn off the camera and the microphone, only because I'm going to be moving things around. So I want to set everything nicely so that you guys can see how we do the protocol. Okay, and then when I come back, I'm going to remove. I'm going to take away the PowerPoint so that you guys can see better, because right now you only have me on the little camera, correct? So that you guys can see everything better, I am going to remove the protocol. But here it is one more time. Okay, this is what we're going to be doing. So I'll be back in just a little bit. Let me go get set up, and I'll be back with you guys again. If you have any questions, let me know, and I'll be answering them as soon as I come back. Okay, thank you. Okay, guys. Let me see, unmute. Okay, can you hear me? Send me a message if you can hear me, please. Yes, I think you can because I see. Perfect. Okay, so we do have our model here, and okay, perfect. So I'm gonna go on the other side so you guys can see. I'm right here. So we can see how the treatment would go. Obviously, we would have probably somebody with a little bit more of hyperpigmentation. Also, the lights don't do justice. Okay, the lights kind of like glare out more, gives me more of a white cast. Okay, but again, this is just a demo on how we would do the protocol. And let me go ahead and stop sharing so that you can see better. Hold on. Okay. Okay, perfect. I think that's better, right? Okay, right here. Oops, no. Cancel. Oh, okay, here. There we go. Perfect. Okay, so one moment, I'll be right there. Yeah, be right back. Okay. Okay, so I'm gonna get set up on this side. And okay, so again, like I said, we have here, right, the glutes. You would be treating your client obviously in your treatment room. And sometimes we have the areas that are the ones that are, let's say, hyperpigmented. It could be up all the way from the waist area, but also this side, okay? These sides are the ones where we usually get the darkening. Um, Hi. So I'm here popping up with you guys. I'm also gonna be on Instagram right now. We're gonna be doing a glute lining, okay? This is what they call the booty facial as well. I don't know if you guys have heard about it before, as the booty facial, but here we go. We're gonna be using our lactic peel, our lactic acid, our derma scrub. So we're gonna start by cleaning the area first, okay? So we're gonna get a 4x4, just as you would with your, facial treatments, okay? And we are going to clean just a little bit. You don't need to do so much of the cleanser, but just a little bit will be fine. Okay. Okay. So the derma cleanser first. Okay. And you want to clean the area. I'm going to do one side on screen. So remember, the derma cleanser is for all skin types. It's like a gel cleanser. It does not create a lot of the, a lot of the stuff or anything like that, that sometimes could be very drying for the skin. Okay, very gently. If you have somebody with stretch marks that are starting to develop, then you would want to do that treatment before you start working on hyperpigmentation. If anybody asks, what would be better to start first, hyperpigmentation or stretch marks, then I would start treating definitely the stretch marks first. Once you start seeing things getting better with the stretch marks, then you go ahead and switch to the protocol for hyperpigmentation. Okay, so now I'm going to dry it. First, you want to make sure that this area is really dry. Okay. And once it's dry, we're gonna start with the scrub. So I'm also gonna have here my timer because you wanna have the timer set up as well. Okay, so the derma scrub, okay. This is our enzyme exfoliator with papaya enzyme, squalane, and the diatomaceous earth, which is our agent, our exfoliating agent. And you want to start working the areas where you have the hyperpigmentation. Like I said before, sometimes you're going to have it along the underline of the panty line, okay? So you want to smooth it out really nicely. And this is going to help by first opening up the area, basically by eliminating dead skin cells, okay? And you can barely see it. It's because the granules are very, very small. They're not going to damage the skin. They're not going to create any sort of cut on the skin, okay? They're very gentle, so it's great for sensitive skin as well. Okay, if your client were to have folliculitis, this is what you would recommend for them to do at home with the scrub. And you see how it kind of almost absorbs into her skin, but nonetheless, you still want to remove it. So you remove it again. You could use, for like larger areas, you can go ahead and use those water wipes. Those are great because they're just water, or a towel, or like I'm doing with 4x4s. Shouldn't be complicated or anything like that. Okay, so you clean the area. Perfect. So now it has been exfoliated, okay? We dry again. Because now we're going to apply the peel, and you want to make sure that the area is dry before you apply a peel. Remember that when the skin is, when it's wet or when you just get like a cleansing, you always want to make sure that you dry it out before you apply any sort of acid peels, because that way it won't be as irritating. Okay, perfect. Okay, good. So we're going to get the the lactic acid. Okay, and I'm going to use one of these little glass jars, and I'm going to have my lactic acid right there ready to go, and also my neutralizer. You always want to keep it ready. So 1 dropper, okay, just 1 dropper of your lactic acid. And then you want to have another jar, and I like to leave, you see how they're kind of like the same? I kind of like to leave the bottle of the acid that I'm using behind, so that way I don't get them confused. So I'm going to have my neutralizer, and I'm going to do 1 dropper as well. And then when I set it up back on the table, it's going to be right behind the jar. That way I know this one belongs to my neutralizer, and I don't get them confused. Okay, so now I go ahead with a brush and I'm gonna time for 7 to 8 minutes, okay? So you wanna start in all that area. Try not to cross so much so you're not overlapping. And you wanna work the whole glutes where you see the hyperpigmentation. Again, this could be due to acne, post-inflammatory hyperpigmentation. It could be due to folliculitis. So depending if it's acne and it's still active, you want to work on that first before you start working hyperpigmentation. You want to make the acne better, and you can follow our acne protocol for that. Okay. If it's folliculitis and it's still active, or you still have inflammation of the follicle, then you want to work folliculitis with that protocol first. Okay. And now I'm gonna have the timer set up. Um, let's do right now 7 minutes because I already started. And since the moment you apply, you want to start your timer. Since the moment you start applying, that timer needs to start going, okay? So let me see any questions. Okay, perfect. Okay, so again, we want to stay with the client. We want to make sure that their skin is feeling all well. Are you feeling okay? Yes, perfect. No, you're comfortable? Yes. Okay. So she's comfortable. She's not feeling any burning sensation or any itching or anything like that. So we're good. We just have to make sure that there's no reaction, there's no redness. There shouldn't be. Again, the glutes area is more resistant than comparing to our face, the skin on our face. So there shouldn't be any sort of irritation or anything like that. So again, we have the different protocols. We have one for the stretch marks, okay? With that one, you are going to apply the 40% glycolic directly on the stretch marks. So if, let's say she was our client with stretch marks, I'm gonna pretend this is your your Q-tip. It's gonna be wet, okay? And then you just kind of wanna apply it where the stretch marks are. So you're gonna go in the stretch mark, okay? You wanna go in the stretch marks. That's how you're gonna work the stretch marks. So you're gonna have the Q-tip with 40% glycolic and you wanna go and paint over the stretch marks. You're gonna leave it on for 7 minutes and then you're not gonna neutralize it. And then you're just going to apply the ceramides NPX and your client's good to go. But since we're doing the hyperpigmentation, the lining of the glutes, we're working with the lactic acid, which we know has great properties when it comes to hyperpigmentation, lining of the skin. This is also the same protocol that we're going to use for underarms, in between the groin area and also neck area. You can also use it on the elbows, just a little bit of scrub around the elbows, and then apply the lactic acid, leave it there for 7 minutes, remove it by neutralizing it, and just add a little bit of epifacto, okay? You could do that also for the knee area as well. You can do that around the belt area. Some of us get like the hyperpigmentation around the belt area as well. And in women, the bra, okay, that creates also post-inflammatory hyperpigmentation around that area. So this is the same protocol you would use for the lining of those areas as well. Okay, so do you guys have any questions here with Instagram? I'm sorry because I have you guys over there and I can't see if there are questions, but I'm sure that anybody can, we're gonna have it recorded, so anybody that can see from DermaSwiss offices, they can also answer those questions for me right there, or leave us a message on the video and we can answer back as well. Okay, so let me check right here if there are any questions with our viewers. Okay, perfect. It's very, I mean, it's a very easy protocol. And again, you can offer it for $40, $50, up to $60, depending where you are. Obviously, you're not just going to be working one area, you're going to be working both areas. I'm going to do this afterwards. But, you know, you're also going to be, in some cases, working this area. So depending, you would want to figure out how much it is that you want to charge for that treatment, and how often they can do it. If it's, you know, hyperpigmentation, 15 to 20 days would be a good time for them to come back again and work on that. Okay, good. So we're still waiting, and I'm going to remove with another water. Okay, these are the patches. Okay, this is our vitamin C antioxidant mask. There are 5 patches in here. Okay, what's great about it is that you can either use all of the patches depending on the area that you're working, or you can use 2 or 3 patches. In this case, we're going to use 2 patches on her. So you have 3 more patches to work on any other treatment. This is not just for the glutes. This is also for our Radiant C treatments, our antioxidant recovery treatment, anything that has to do with, you know, a skin that's been damaged by the sun, that needs a little bit of uplift because you have, you know, hyperpigmentation, because you have smoker's skin where it's dull, lack of oxygen in the cells. This is the one that you want to use. So the way that we use it is that we use 1 or 2 patches. We combine it with our dermatonic, which is our toner for all skin types. We mix it very well, and then we apply it with a brush or with your hands, and you massage it for 5 minutes on the glutes. On the face, you would do the same thing. You apply it on the face, and that's how you do your massage with that product on the skin for about 5 minutes. And then you leave it on for another 10 minutes. And once it dries, you remove it with water. Okay, so let me start opening this right here so I have it ready for you and you guys can see. Okay. It does have a corner on the side here. It does open. It's just that I'm having a hard time right now. Okay, there we go. See this little corner right here? It shows you where to open it. Okay. In my case, I'm going to use the bowl. I'm going to set it up here. I have one patch. Open a little bit more, and then my other patch right here. There we go. And if you feel you need more, you just keep adding the patches. Okay, so I'm gonna have it ready now. In a little bit, we're gonna mix it with the dermatonic. Let me see the timer. Okay, good. So we're good. We're gonna neutralize now. Okay, so we're gonna neutralize. Okay, here's my neutralizer. And again, starting where we first began from the top, make sure you're covering all the area and neutralize. Okay, perfect. And then once you neutralize, you don't have to wait or anything like that. You just right away, you remove with water. Okay, just wipe it again. Okay, wipe away with water. Perfect. All right. Okay, and now we're gonna mix. We're gonna mix the patches with the dermatoner. Our dermatonic, it's our toner. It's great for all skin. It's anti-inflammatory. It's hydrating. Just a little bit, okay? And you get another brush and you dilute. Okay, dilute, dilute, dilute more of the tonic. You're gonna start seeing that it's gonna turn almost like a yellow substance. It almost looks like egg yolk. Okay. Okay. It almost starts looking like egg yolk. There we go. Perfect. Okay, it's gonna be very thick, a very thick consistency. And it doesn't matter if you still see some of those little, some that haven't diluted, but you're gonna keep diluting with the massage. So you apply it all over. And you see how much we have now, only with the two patches? Perfect. Okay. There we go. So now, okay, you do want to do this part. This is not something you want to skip. Not on the glutes. And when you use it on the skin of the face, you want to do your massages with this product. So all those lifting skin massages or face massage that you do, you want to do with the mask because it's helping with penetration of the active ingredients. Remember that we have ascorbic acid, squalane, marine extracts, and that's going to give you all the glowiness. It's going to help with hyperpigmentation. So you do not want to skip the step. if you do have a lot of the hyperpigmentation, those areas, that's where you want to work. Okay, so for her here, where I'm seeing it, it's more along this line. Okay, so that's where you want to work, those areas right there. Okay, and okay, so when you're working on your actual client, because this is a demo, so I'm doing one side, you're gonna have both sides. So you're gonna be working one side and then the other side. Let's say you apply first here the peel, then you apply it here. You neutralize one side, then the other side. You apply on one side, then the other side, and you're gonna be working simultaneously. Okay, so if you want to be working on this side, you want to be working on this side as well. Okay. And again, we leave it on for about, we massage for about 5 minutes, and then you leave it on for another 10 minutes on the skin. Let me see if I have anything left. Yeah. Another way of applying this is just directly putting the patches and then spraying the toner, and you start by dissolving it with the toner on the skin. Once the patch is on the skin, you start working the toner. Okay. Okay. Perfect. So we leave it out there for a bit. Let's see, right here. Okay, I'll be right there. Let me check for the questions. The extractions are before the acid. Well, if you're doing extractions because the glute area you have acne, then you would be doing the acne protocol where in this case, we're gonna be using the mandelic acid. And yes, you're gonna be doing extractions. You're gonna be doing the scrub. So for the protocol for acne on the buttocks is the same as on the face. You cleanse first, but in that case, you're gonna be using I can't see you guys. Hold on. You're gonna be using the line for acne. Okay, so you're gonna be using a normalizing lotion and our purifying cleanser. You cleanse with a purifying cleanser. Then you would do the scrub. So the derma scrub, since you have acne, you can combine it with the salicylic acid. Remember that we said that you can combine the derma scrub with the salicylic acid. You do 3 drops of salicylic acid with the scrub. You apply it on the skin and you scrub while you have the steamer. Okay, and you activate the scrub for let's say about 5 minutes. Then you remove the scrub and then you do extractions. Okay, then you work on the extractions. After you're done with the extractions, you also do high frequency, okay, on the buttocks area. And once you're done with the high frequency, you can go and apply mandelic. So when we do acne, we use mandelic directly on the skin because we already used the salicylic with the scrub. So the second peel that you're going to be using would be mandelic. And at the same time, the mandelic acid is not just going to work with the acne because it's anti-inflammatory, it's anti-seborrheic, but also it does help with hyperpigmentation. So any post-inflammatory hyperpigmentation that may be going on from beforehand is going to help with that. Now, if the acne has stopped, the client has stopped having those breakouts, and you just want to work post-inflammatory hyperpigmentation, this is the protocol you're going to use. Okay, but answering the question again, yes, you would do first a scrub with the salicylic, then the extractions, high frequency, and then apply the mandelic. You leave it on for about 8 minutes, and then you neutralize it. Okay, and then you just end your treatment. That we have a protocol for acne. Again, then you can ask your representative, and they can give you the protocol for acne as well. Okay. Okay, did I answer the question, Maria? Okay, perfect. Let's see So this protocol that I'm showing you right now is not directly an acne type of protocol. This is for the lining of the glutes. Okay. Again, if you have anything like acne or folliculitis, you want to treat that first. You want to address that problem first. Once you have that addressed, then you can start with this protocol for the lining of the glutes. And again, it's not just for the glutes. This protocol you can use on the underarms, between the groin area, the neck area, elbows, and knees. Okay, you're welcome. Okay, so now we're gonna remove. Okay, we're gonna go and remove. Give me another 4x4. Again, you can use your 4x4s. You can use the water wipes. Those are bigger, so it might, or you can use wet towels. So it's gonna dry. It's not sticky on the skin, but it gives a beautiful, beautiful glow. At least, I mean, obviously on your buttocks area, you're gonna be wearing your pants and your shorts, but for the summer, this is great. Those young ladies that have their mini shorts or when they go to the beach, obviously you're not going to go to the beach right after a peel. This is something you want to start doing now so that, you know, you're ready for those plans that you have maybe to go spend the day at the beach. But you would have to do this way before because you don't want to get hyperpigmentation because you got a peel and then you went under the sun. So you don't do that, okay? Um, any special days that you might have. So this is the right protocol for you just because you know, you just want to line the area. And then one more time, one more pass. Make sure you remove it well. Don't be afraid of removing or, you know, passing several times. You want your client to be happy and not feel sticky or feel any sort of discomfort. Okay, but this is very easy to remove. Okay, perfect. Now we have removed it and we're going to apply the EpiFactor. There's my EpiFactor. Here it is. Again, cell rejuvenating. It's going to help with the regeneration of the cells. It's going to help with wound healing. So this is a product that we're always going to use after any of our peels, any of our microdermabrasion treatments, any of our microneedling, anything like that. It helps with wound healing. So this is going to help restore the skin. Okay, just apply a little bit. There's no need for the SPF because, you know, she's going to cover herself up now. But for you guys to know, the SPF, it's mineral. It's a 50% SPF. Mineral, say for our coral reefs, it's mineral, which means that you don't have those, you know, chemicals that are going to create maybe some dermatitis or to be sensitive to those type of chemicals. So when you have a SPF that is mineral, it's only going to have titanium dioxide and zinc oxide as your active ingredient. Okay, and it's 50 SPF. Okay, that it is white, but once you emulsify it and then you apply it on the skin, it kind of just goes away. You can't see it. Okay, I'm just going to put a little bit here just to show you. You emulsify it and you apply it on the skin, and it's going to keep you protected from the sun rays. Okay. Okay, so let me go on the side now. Let me cover my client. Okay, guys. Thank you so much. Do you have any questions? Okay, let me see. How much can we charge for this service? Okay, so this service, depending where you are. Okay, so I don't know if you guys are seeing me here, but depending where you are, if it's here in Miami area, it can go for about $50 to $60. I know in some places they charge a little bit more as well. You would have to kind of figure out in the area where you are, in the state or the city, how much the treatment is going for. But suggested around $60 minimum. Okay. Let me see any other questions. Okay, guys, so let me see. Thank you so much for being here with me. I'm gonna log out now because I'm in a little bit of a awkward position here. There we go. Okay, so thank you so much for being here with me today. Can you use LED? How long can we do this treatment? What do you mean how long? Like how often? How often? I would advise from 15 to 20 days. Okay. Now, can you use LED? I wouldn't. I would do LED before the peel. Okay. There's been some instances where the LED might create a little bit of hyperpigmentation. I know it sounds weird, but if I would have to pick, I would do probably LED before to start treating the skin and then do the peel. So for hyperpigmentation, you would do red or you would do the green. If it's acne, then you would do the blue. How many times do we do it? Again, you want to try to have your client come back every 15 to 20 days for hyperpigmentation. Let me go back here before we go. Remember to contact your representative and they can give you the protocols. And also, let me give you the number in case you do not have a representative. And I'm going to put the protocol back here. I'm going to share it again. Okay, so you guys can see it right there. Take a picture if you want, but I would suggest that you call us at 305-663-2882, and that way you can, if you're already using the line, you can have the protocols as well. Yes, first you would perform the acne treatment. You want to every time you have like a concern to the skin, you have to see what's the most prominent one. Okay, if it's acne, that's going to be the concern that you want to first attack before hyperpigmentation. So try to do that first. Try to get that acne under control by doing the treatment in your treatment room, but also sending your client home with the acne treatment, okay, so that they can keep doing it. So then when they come back, maybe after 15 days, if the acne has ceased or you don't see any more inflammation, then you can do this protocol. Can you guys see me there? Sorry, on Instagram. Hello, everyone. My clients, I have special to you. Text me. Yes, text Andres. He's one of our representatives. So Andres is one of our representatives. You can, if you guys are here, text him, and he has a special. Oh, let me put it back again here for you guys. Okay, hold on. So for today, for our pros, for our estheticians, if you already have your representative, he or she can help you with today's promotion. Okay, so call Andres, call Erica, call Monica. Okay, we have Paola, Natalie. Those are all representatives that can help you out. Okay, perfect. If there are no more questions, thank you. Thank you for being here with me today. See you soon with another one. Okay, guys? Bye. For the hyperpigmentation, you would do about 6 to 12 sessions, okay? 6 to 12 sessions, yes, for hyperpigmentation. Okay. Bye-bye, thank you. A la orden.